Ever wondered what Tourette's syndrome is and how it affects those who live with it? Today, we're going to dive deep into the world of Tourette's, providing a comprehensive understanding of this complex neurological disorder. To begin with, let's explore the symptoms of Tourette's syndrome. These can range from mild to severe and may include both physical and verbal tics. Physical tics often involve repetitive, involuntary movements such as blinking, shrugging, or jerking of the head. Verbal tics, on the other hand, can include grunting, throat clearing, or even shouting out unexpected and potentially inappropriate words or phrases. It's important to note that the specific tics and their severity can vary greatly from person to person. So, what causes Tourette's syndrome? The exact cause remains unknown, but it's believed to be a combination of genetic and environmental factors. There's evidence that the disorder is linked to abnormalities in certain brain regions and the neurotransmitters that help nerve cells communicate. It's also thought that Tourette's may run in families, suggesting a genetic component. Diagnosing Tourette's syndrome can be a complex process. There's no specific test for the disorder. Instead, a diagnosis is typically based on the history of symptoms. A person must have several types of tics, occurring many times a day, nearly every day, or intermittently for more than a year, for a diagnosis to be considered. The onset must have occurred before the age of 18. It's also crucial to rule out other conditions that could be causing the symptoms. Now, let's delve into the treatment options. While there's no cure for Tourette's syndrome, treatments are available to help manage the symptoms. Behavioral therapies, such as habit reversal training, can teach individuals how to monitor their tics and use competing responses when they feel a tic coming on. Medications may also be used to help control tics, especially when they interfere with daily activities. It's important to remember that the goal of treatment isn't to eliminate all tics, but rather to improve the quality of life. In summary, Tourette's syndrome is a complex neurological disorder characterized by involuntary tics. The cause appears to be a combination of genetic and environmental factors, though the exact cause is still unknown. Diagnosis is based on a history of symptoms, and while there's no cure, treatments can help manage symptoms to improve quality of life. Understanding Tourette's syndrome is the first step towards fostering empathy and acceptance for those living with this condition. So keep learning, keep asking questions, and keep the conversation going.